So let's talk about fixed orthodontic retainers because I do get a lot of questions about this. So let's go over that. So several doctors have asked why a lot of the orthodontists and dentists don't place fixed retainers anymore on the upper and lower arch, and there are actually several reasons for that. So fixed retainers is just that bonding wire like I'm showing you here. They go on the back of the teeth either on the upper arch or you can actually put them on the lower arch too. And they used to be very, very popular in 1990s and 2000s, but actually they present a lot of problems. One is hygiene problem. A lot of times patients will not floss. Patients don't want to floss anyway, but they really don't want to floss if their teeth are bonded together. And on the upper arch, a lot of times you can still floss with a fixed retainer, but on a lower arch, it's very difficult. So that's one thing. The second thing is fixed retainer wires, they're actually bendable. So what happens if a patient bumps it or chews on something, or God forbid they floss and they bend the wire, the fixed retainer will actually act like braces and they actually move the teeth. There was a recent article that came out that shown actually evolves teeth where the fixed retainer actually pushed the teeth out of the bone because the wire bent. So you can actually have pretty big issues with these fixed retainers. The third thing is a lot of times if a patient's bite is really tight, they don't have much overjet and they have a little bit deeper bite, even after orthodontics, maybe just a little bit, there's very low room to put fixed retainers on the upper arch because there's just no room. They will be biting on the wire. So in some patients, it's very difficult to put fixed retainers on. Hygiene issues are the biggest thing, wire bending the other, and a fifth issue is that a lot of patients so with a fixed retainer, you need to, of course, give them a removable retainer too, because the fixed retainers really only hold the teeth that are bonded to, and they're not even really good at that. So you need to give them a removable retainer. But patients who have a fixed retainer, they think, oh, I got a permanent retainer. I don't need to wear my removable retainer. And then all of the teeth shift in the back, and a lot of times the fixed retainers are not really good at holding the teeth anyway. And the other thing is a lot of times the wire comes unbound from the teeth. And the sixth reason is like it's a constant maintenance. So you can imagine if you treat 200 patients, 200 new patients a year with braces, how many fixed retainers you would have to maintain because these things going to come with the maintenance when they come debonded and things like that. So a lot of times patients will be coming back for repairs. It's expensive. Patients think you should maintain it for free for life, which is of course not true. And you need to be charging for this, but you need to charge at least your time and labor and material. So it's hundreds of dollars to repair these fixed retainers. And the other thing is don't ever call them a permanent retainer, because if it's a permanent retainer, then you communicate that they should last for life, which they don't. So to answer your questions, a lot of doctors don't place these fixed retainers anymore because they come with a ton of maintenance. Now, I like to only place them in certain situations. So when I teach specialists and general dentists, we have a program for general dentists to learn orthodontics. I like to teach to place fixed retainers only if a patient started with spaces or diastema between the front teeth. So when you bring the teeth together, you put the fixed retainer on to hold the teeth together because the diastema wants to come back, especially if there was a strong frenum. So you need to clip the frenum, but still put a fixed retainer on to hold those teeth together. So those are the cases I do like to put fixed retainers on just on the upper arch, and I usually only put it upper 2 to 2, which is just lateral to lateral, sometimes just to the central. Sometimes if you put it back to the canine, the patient might be biting on a fixed retainer, or you have to put it really close to the gums, and that is just a hygiene issue. So when I like to do fixed retainers is when the patient started with spaces, and then I tell patients it's not a permanent retainer, it's a fixed retainer, and we're going to keep it on until it comes loose, and then we just take the whole thing off. And then I like to give patients the Vivera retainers, which come in 4 sets, and those will hold the teeth really nicely. And even if the fixed retainer breaks, they still have the Vivera retainers. But it's very important to tell patients that even though they have fixed retainers, they have to wear the removable retainers, and then these fixed retainers can actually move your teeth. So in our practice, I only keep these fixed retainers on as a temporary solution, and I tell patients we just keep them on until they get loose, in which point we remove them. But there's always a charge with fixing it, replacing it, removing it, things like that. And I pretty much never place lower fixed retainers. I can't remember if I did a single one last year or this year. I usually don't like placing lower fixed retainers. The upper ones I can also do directly. So the upper ones you can learn to place directly. I also teach that. It's pretty simple, so you don't have to have a lab fee with that. The lower ones you really need to get a lab fabricated carrier tray to put the lower fixed retainers on. It's a lot more work, and a lab bill is probably $80 to $100 for those. But the upper ones you can place just directly, and you can get the wire from Reliance Orthodontics. Makes one of the best fast fixed retainer wire, it's very easy to adapt the teeth. So hopefully this helps, but because of all these issues, a lot of doctors are opting not to place fixed retainers anymore, and I would add that I do like to place them when a patient started with a diastema. So hopefully this helps. And if you have any questions, if you want to learn this, we do have an orthodontic mini residency. It's completely 100% online for both GPs and specialists. You can learn comprehensive orthodontics. And if you have any questions, just post it below this video.